Welcome to this weekly COVID-19 update. My name is Dr. Agnes Mahomva, the Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. Ms. Susan Masona is with me on the sign language desk. This week, our vaccination program continued to gather momentum. Large numbers of people came out to get vaccinated. It is very important that we continue on this great path. My update today is therefore going to focus on vaccination questions that have continued to come up during the week to make sure that we all have the right information and are sharing accurate information so that we encourage others who haven't been vaccinated yet. Remember, we are aiming to vaccinate over 60% of our people, our population, to achieve herd immunity so that we can protect everyone, including the few that are not eligible for vaccination, such as those who are critically ill and children who are not eligible for vaccination. But first, let us, as usual, quickly look at our statistics for COVID-19 for this week. As of yesterday, Thursday, the 31st of March, 2021, Zimbabwe's cumulative number of COVID-19 cases was over 36,800, with over 34,600 recoveries and 1,523 deaths. Our main hotspots are Harare Metropolitan Province, followed by Bulawayo Metropolitan and Matabeleland South Province. These places continue to have the largest numbers. By the end of the day yesterday, the cumulative number of those who had received the first vaccine dose was over 79,000, almost 80,000. And of these, over 14,000, almost 15,000 had received their second dose. This week, several breastfeeding mothers wanted to know if they too should get vaccinated. Well, the COVID-19 vaccines that Zimbabwe has authorized, approved so far are non-replicating vaccines. We keep referring to them as killed virus used as a vaccine. This means they are able to create immune response that protects you, but they do not replicate. In other words, they do not cause disease. Science tells us that vaccines that do not replicate in your cells do not pose any risk for lactating mothers or their infants. So theoretically, breastfeeding mothers can therefore choose to get vaccinated. Note, however, that because these are new vaccines, scientists are still gathering additional specific data on COVID-19 vaccines and breastfeeding women, just to be very sure and careful. Another area that has come up this week is on disabled and mentally challenged people. We are all very aware that some disabled and mentally challenged people have problems adhering to COVID-19 prevention measures. This has quite clearly prompted several caregivers to ask if disabled and mentally challenged people should be prioritized like all other people we are prioritizing. Well, disabled people and those that are mentally challenged should indeed be prioritized. This is the same way that we have and will continue to do, prioritizing them in provision of all other health services in our clinics, hospitals. Let us therefore help them and ensure that they too are vaccinated in a timely fashion. A few weeks ago, I gave a detailed update on how the private sector can work with government to procure vaccines for their employees and families. Several questions have, however, continued to come up during the week on this particular issue. Government, through the Ministry of Finance and Economic Development, remains the sole buyer, procurer of COVID-19 vaccines in Zimbabwe for both the public and the private sector. All payments for vaccines are done through government. That's the Ministry of Finance, which in turn procures on behalf of the organizations in line with the national procurement guidelines. Very, very critical that we understand this. Any organization, including medical aid societies or individuals wishing to procure vaccines for their people, should do so through the National Vaccine Fund. This fund is coordinated and run by the Ministry of Finance and Economic Development. Anyone, and I mean anyone interested in this initiative supporting government is encouraged to work directly with the Ministry of Finance for further details in terms of where they deposit their money and so on. Finally, all organizations are expected to align their vaccination program to that of government. This includes aligning it with the vaccinating individuals free of charge, using the Medicines Control Authority of Zimbabwe approved vaccines that are procured through government. And once again, Ministry of Finance is leading that. Let me remind ourselves that COVID-19 vaccines help protect against severe disease. They protect against hospitalization and death. Do, however, remember that COVID-19 vaccines are an additional preventative measure. They are not an alternative to the public health and social measures that we have been implementing from the very beginning of this pandemic. As we celebrate Easter, let us all plan to get vaccinated first, but also make sure that we continue with all the other preventative measures. Let us avoid unnecessary travel, and let us stay away from crowds and those big gatherings. They are not necessary. Let us wash our hands frequently with soap and running water, and of course sanitize frequently if you can't wash them with an alcohol-based sanitizer. And yes, let us also always continue to wear our face mask, and let us do it properly. Happy Easter holidays, stay safe, and thank you.